Can hear me. We're a couple minutes after 11. So just a little idea of how we're going to run this. So for all the attendees, thank you for being here. We appreciate you registering and attending. And so this is going to be about a half hour, and then we'll take Q&A will be through the chat. So if you have a question, just type it out, and if it's relevant to the section, we'll may stop. But we're going to try to take all the questions at the end. We'll field those and try to address as many as we can. So again, about 30 minutes. So I'm going to turn it over to Dennis Hartin, who's the host. So there you go.
All right, well, welcome. Thank you, Steve. I appreciate it. So good morning, everybody. We're excited to pull this together and share with you some of the stuff that we've been working on. I've been working with Roundstone and Steve Sullivan specifically for about 2.5, almost 3 years now, I would say. It's very early in our conversations as we launched our company. I found a really good partnership with them. So they have brought some things specifically to the table for my team and for my organization that we wanted to share with you. I just felt like some of it's really good. And what I see more and more every day are just employers who aren't aware of all the options that are out there in the market. So we've done a lot of these hot topic type events, but as we transition to more of a virtual world, we wanted to get some good information in your hands, especially with this time frame of the year. So many employers wait till the end of the year to look at their renewal. They get it like 60 days out, and by the time they review it, get frustrated, try and track down some additional options, the window closes so quickly. So the timing that we're doing today, I think, is very appropriate because the best clients that we work with, we're analyzing what 1/1 is going to look like today and making decisions today. So if there needs to be any meaningful change, we have plenty of time to make that happen. So all right, so if you don't mind, Steve, would you jump to the next slide? And we want to talk just briefly, probably about the least important topic is just who I am with Hartin Dynamics. We are a long-term, full-service benefits firm. We've only been in place in Florida for the last 3 years, but we partnered with a bigger organization called Peel and Holland out of Western Kentucky. So we have 6 locations. I am the primary Florida location, 36 states. Technically, we've been in place, I guess, 96 years now because this slide's been up there for a couple of years, and we've got thousands of clients. So ultimately, we want you to know that we're affiliated with all kinds of organizations that put us on the forefront of benefits in plan design and strategy. So all those names at the bottom are very relevant, but I don't want to bore you today with those details. We're happy to talk to you offline about that. So next slide, Steve. So we want to share with you what we're seeing. This is really probably not a new conversation, but for most people, but we have, with most of the clients we've run into, they're seeing double-digit increases. The client that we just brought on board said this is the first time in 18 years that they weren't looking at a renewal where they were going to have to raise their costs and cut the benefits. So double-digit increases have become the norm. So what you're going to see is employers with 20 to 1,000 employees have historically, for an extended period of time, been passing that cost off to the employees, transitioning, shifting, raising deductibles, cutting benefits, raising the money that the employees are having to put into the plan, going with more narrow networks. There's a lot of strategies that they've done, but what I'm finding is that most of those clients are actually kind of maxing out their employees' tolerance for how much that they're paying for benefits, and they're also maxing out their ability to take higher and higher deductibles. So a lot of the strategies that were in place that push deductibles higher have actually caused delays in healthcare. And so people aren't necessarily going to the doctor to get treated, which makes the problem even worse. And then if you look at the actual trends, we've been watching this chart for a couple of years. I started paying close attention to it in late 2016, but you can see since 2017, there's a massive spike, and it actually represents $30,000 for a family of 4 out of that employee's and the employer's pocket. When you look at what you're paying as an employer, what the employee's paying in premiums, and then what the out-of-pocket expenses are, it's the equivalent of a family of 4 buying a new car every single year just for healthcare. It's just gotten out of control. And it's definitely outpacing inflation. It's outpacing earnings for organizations, and certainly outpacing wages at an exponential rate. So you can see that there. So here's what we look at. Ultimately, the problem is fairly simple. For smaller and mid-sized businesses, it's a top 2 or 3 line item at this point. The current costs are set to double in 4 years, and you have zero transparency to have any understanding as to why your rates go up. You might hear every year, well, you had a big claim. But the reality of that is it's just kind of a sales pitch from the carrier to get you to take an increase year over year. And it's worked for so long, it's become the norm. Most employers I deal with don't even know some of these options and solutions and transparency are even an option for them. And so we're excited to kind of share with you what a couple of those things are. So if we know the employers are losing, let's talk briefly about who's winning. Like somebody's got to be gaining. And I can show you a really interesting slide that just kind of points out all of the players in the game. But the thing that's the most interesting to me is that if you look at these companies, all of the big traditional health insurance carriers, many of them look like and advertise and say they're doing things to help. And I'm not saying they're the big bad wolf, but I am saying they are benefiting exponentially. And they're doing it on the backs, in my mind, of the employers and the employees. So that's the people that are losing. These guys are winning. In fact, if you go to the next slide, Steve, I think we can share with them how big they're winning. Massive, massive increases. We actually, Steve, didn't you have an employer that said, if I'd invested in these companies, I could have offset my increases because their gain is so massive. There are no companies out there that are growing at these rates. And it's really just unfortunate because we're in an environment where every dollar counts today. And what I've seen in the last 60 days is employers taking a much more strategic approach and looking at where every penny's going. There really is no reason to play into this game with the carriers where they're benefiting. There's ways to navigate around it. So from your situation and what you're looking at, if you didn't think there were any other options other than these, and this is what your broker is bringing to you every year, we're excited to share with you some of the items and some of the things that we'll be able to plug in today, especially right here in the Tampa market. So if you look at the Bureau of Labor and Statistic reports, this one was most critical. This is the one that surprises most people. The actual healthcare costs are only increasing at 2%. The healthcare increases on premium are going through the roof, and you can see that the CEOs are getting massive increases in their pay. So the inflation or the trend, right? I had one of the big carriers recently tell me, hey, Dennis, this group, I said, why are we getting a 12% increase? They said, well, the trend in the market is 11%. The reality is the trend of cost increases is actually less than 2%. And the reality of it is from an industry, if you think about the big surgeries that cause big claims, we had 90 days plus where because of COVID, no big surgeries were even happening. So we literally should have about a fourth of what they expected us to pay out cut out of that. And yet they're coming back to us and saying, oh, you should be paying 12% more. It's just a sales pitch, and it's unfortunate because so many people don't know there's a better way. So Steve, on the next slide, we know that the BUCAs are winning, small to mid-sized employers are losing, and we wanted to change that. So let's talk a little bit, I believe we need to share just a little bit about, there has to be an alternative. This was not a bad news story this morning. We just wanted to set the stage so you understand what's going on and who's being impacted. So let's talk about the alternative. So give us a little bit about Roundstone. I've worked with you guys for a long time, but where do you guys fit into play here?
So that's a good question, Dennis. I appreciate that. So we feel that the employers today, particularly the mid-market employers, should be able to purchase their health care like a Fortune 500 company. And what is a Fortune 500 employer is usually the next question. And this is the definition of one. Fortune 500 puts out an annual list of the 500 largest public and private companies in the United States. And average number of employees is about approximately 50,000. And what is defined as a 500 is a company with large enough to enter direct contracts with a provider system, like a hospital, as well as purchase all fixed expenses, through their vendor services at a discount from retail because they're so large. So utilizing these large actuarial consulting firms, they also kind of like what you do, but much more expensive and consists of thousands of employees to analyze their healthcare spend and come up with strategies and designs and implement these strategies to reduce costs or contain costs. And then they self-fund and looking at a long-term strategy. And they consistently keep their health cost care spending trending towards a normal inflation level. And their fixed costs, as it says on here, are typically single digit to teens. So we think, and then how do we define, I just mentioned what's a mid-market employer. So it's a official definition, as it says on here, is a public or private with sizable annual revenues that straddle the middle market between smaller companies and the billion-dollar giants, right? The way we define it here at Roundstone is that it's an employer with 20 to 1,000 employees on the plan who use the three-headed monster to manage their healthcare spend with a short-term strategy and consistently have fixed costs like 40 to 100%. And it was something you mentioned earlier, that three-headed monster that they use as strategies for reducing costs. Number one, their big thing is you shop your carriers trying to get the lowest price, right? Shift the costs, as you mentioned earlier, to the employees. So more premium expenses going to employees, or they may change the plan design and weaken the coverage, all to try to get the pricing down. So if you want to, a lot of people don't realize this, but 9 out of 10 employers with more than 1,000 employees self-fund using a traditional ERISA plan. Larger employers manage their healthcare spend, like I said earlier, and they manage it to more of a, not towards a medical trend of 3 times inflation, but more towards inflation levels. And they get the opportunity to, provide, better class in the networks, carve out PBMs. They go after, they have centers of excellence for better care. So there's a lot of tools and control and strategies for controlling those costs and reducing costs. So what we have is Roundstone's group medical capital enables the same results as these larger companies have been enjoying. And these smaller companies like yourselves at 20 to 1,000 life group, they can enjoy the same as these large groups. So how does a healthcare how do you purchase like a healthcare your healthcare like a Fortune 500? So basically the employers band together, right? So they group purchase the catastrophic insurance, that's their stop loss. Group purchase approach to networks and direct primary care givers. They group purchase all vendor services, data analytics and consultants, control over their cost drivers. And then they realize a higher variable cost plan. So those are the way they do it. And what is a group captive is usually what I'm asked. Captive and to you and I, Dennis, that means something. But to somebody making widgets or I don't know, they're a manufacturing company, they're making something else. Probably a better way to put it, it's a pool of employers, right? The pool of employers, each underwritten separately, but this pool of employers is banding together to reduce costs. So, and that's the key to it.
I love that concept of the tribe, right? So you're pulling together your group of people, you're protecting, what you're spending, and then there's a reward at the end, right? So I love that concept when you look, because it's packaged up. A lot of that sounds complicated, but it's actually pretty simple, and it's done behind the scenes, and it's very beneficial to the employee, so they don't see really a negative impact of that.
Correct. That's a great point. That analogy of a tribe, it's there to, number one, protect, mitigate risk, and 2, reward. As a member of that pool of employers, the captive, you get to share in underwriting profits, and I'll talk a little bit about that. This is just a little bit about Roundstone, but basically, Roundstone's been around since 2003, launched first medical captives in the U.S. 2005. We have over 400 employers in our captives today. So the captives are large, and that's what you want. You want a larger group of employers all working together to try to do the same thing. So right now you basically got three choices, right? So let's take a look at them. So fully insured, yeah, you get 100% fixed cost, but you have no control, right? And you just mentioned earlier, you have no transparency of your spend. You don't really know what's going on. So 100% fixed costs, whatever you pay, no matter how well you run, all that money is gone, right? Each year. A self-funding, that's traditional self-funding. This one seems okay. Fixed costs are lower, 40% versus a fully insured. You have some control, but you don't have complete transparency. But the issue is you're by yourself. So you take 100% of claims volatility. Now the group captive, that's what we're talking about today, this pool of employers that Roundstone offers and that you, Dennis, is offering as part of an option for your employers that you work with. That's going to take their fixed costs down to 15, 20%. You'll have full control, meaning that you have transparency of your spend. You'll have flexibility and control of your plan designs. And hopefully you'll be saving money at the same time. And the employers, you have, so as the captive takes on as a group volatility of claims in this case.
Can I say here too, Steve, that the misnomer that comes back to me over and over, and this is the part that I'll give you just a little bit of behind the scenes. The fact is, I've seen agency after agency and advisor or broker after broker that I've been in meetings with where they've said, yeah, we looked at self-funding for you. And so a lot of the people I run into say, well, isn't it too risky? You have no more risk in these other models. We buy reinsurance just like the big carriers do. But you may have an advisor who's saying to you that we looked at that, but it's too risky for you. You got a couple of sick people. And the fact is reinsurance equates for that. Like we account for it. So, you have no more additional risk in my mind than what you're doing now. In fact, what you're doing right now is you're paying the worst case scenario every single year, guaranteed, right? Which is a little bit frustrating when you realize exactly how that's playing out. So don't be fooled by the advisor that's getting contingency bonuses from these particular carriers, because I will be candid with you as a broker, it is frequently easier to go down the carrier road and just pick a company. That's what everybody's used to. And there's big bonuses in it for us. So some of these other opportunities are not less complex for us. They're simpler for you as an employer, but they take a little bit more work on our side. So it's not something that a lot of my peer group even want to get into. And if they do, they may cut into some of their contingency bonuses with those carriers. So they're not always advising the client, I think, in a transparent way.
Great points, great points. So the next step would be, how does it work? And you've asked me this before, when we first met, Dennis, how does it work? So basically, we're taking the claims fund obligations and we divide them into three layers. Okay, so so if you think about the layers, the first two layers, risk taking and risk sharing. So the first two layers, your employer will keep whatever funds they don't spend in those first two layers. Okay, so there's three layers to our model. First layer, you take on, this represents about 60% of your spend is this risk taking. That's their claims fund, right? The next layer is that captive, right? The captive is that pool of employers working together. They're going to take on the next layer of claims as they grow. But in this example, this employer will only take on claims up to $20,000 per member, right? It could be $1 million claim comes in. This employer would only pay the first $20,000. The next $20,001 up to $500,000 is paid by the pool of employers. And then anything above $500,000, this is your stop loss carrier. You mentioned it, catastrophic events, they're covered. So it does limit exposure to the employer, limit exposure to the captive in our model. But again, the first two layers of our model, whatever isn't spent is returned or kept by the employer. Okay.
So I think that's an important point to keep up. I've said that we had to reiterate that twice yesterday, right? It's your money. Yep. If you don't spend it, it's in your bank account. If you want to do anything else with it, you can. right? I've actually seen companies where like, yeah, I have this level funded plan from so-and-so carrier. And I'm like, how much of the money do you get back? Well, when they actually dig into the documentation, more often than not, it's only half of the money that they save. So to me, you need transparency. If you save that money, it should come back to you as an employer.
And that's what we believe too. That is Roundstone's philosophy, I think, aligns with yours, Dennis, in that we believe that, number one, our job is to save the employer money just like you. You know, our model is transparency, you know, flexibility, control, and cost savings. So a lot of people ask me, what's the average Joe or in our pool of employers? So this is some of the things they think about. You know, my insurance carrier doesn't give me claims data. We have no visibility, and we keep talking about transparency, but that's a big part of the model. Knowing what your data is, there isn't too much in your business today where you're making decisions that you have such little data, right, Dennis? I mean, you see it working with the carriers, how little information you get.
Well, and every other business owner knows their supply line and what it costs, right? This is one of the biggest expenses with no transparency into why costs are going up or where the money's even going.
So the other question they get or comments they make is, health benefit is one of my top 3 expenses. We can't afford to keep doing the same thing the same way. And that's what we're here to talk about. And then the other thing on here is to talk about the average size, because everybody thinks, wow, these must be big groups, 200, 300. Average size groups about 103 in our captive. We have a lot of smaller groups in 35, 50 range. So don't think, you know, our smallest group is 17 in our captive. Largest is over 1,200. So don't think that this isn't something that your company can't take a look at. So as we talked about, variable cost is an important part of the structure. 85% of these employers enjoy a variable cost of 85%. So they can go after through that variable cost through cost containment measures and strategies, working with advisors like Dennis. Average spec, I mean, we mentioned a 20,000 spec on the last slide, but the average spec is about 35. And the average employer, the C-suite, the CEO, CFO are engaged. And that's what you see, right, Dennis? You see the CFOs, CEOs, especially in smaller companies. I mean, they're on the front line with their folks. They're right there with them.
Absolutely.
So, Dennis, I just wanted to show you and the folks online, give you an example of a single employer in our captive. This is a manufacturing company out of Cleveland. Roundstone is actually based out of Cleveland, Ohio. They're about a 25 life group, so 25 enrolled. Over 5 years being in our captive, they've saved over almost a little over $565,000 over a 5-year period. That's a great amount of money for a company like this, a small 25 life group company. So I just wanted to show you that, because some of the things they do is wellness initiatives. They have annual on-site screening. So there's a number of things, and Dennis has all that in his quiver to pull out all those strategies and tactics to help you as well. So Dennis, you did a great job when we were talking yesterday, and I love this slide, so I included it on mine, but I wanted you to explain this because it kind of goes back to what I was talking about.
Yeah, so every employer is a little bit different. So just like Steve showed you, over a period of time, even a 25 life case saves upwards of $500,000. That's significant. But the way that we do it, people don't realize you can break these things apart. So we have administrative costs, we have the risk and the reinsurance to protect us and make sure we don't get stuck with one big claim and expose our company. But the vast majority is really going into the claims. So everything that you see in blue is what we can tackle. That's really what you pay me as an advisor to do. Most people are already paying a broker more than what they would have to pay us for our services, and they're paying max cost. And what they're paying that advisor to do for them is to go shop the carriers and have 5 carriers come up with a bunch of quotes. What we do that's different, and what most of my clients end up deciding, is that, hey, I just want Dennis looking at this for me so we can control that claims cost. And however we can control it, he brings to us decisions and ideas and thoughts in ways that he can ultimately help us lower our costs and give us ideas on how we can lower our costs. So when that happens, we save as a company. They want me as the advisor to do that for them. So I'm managing the claims fund. we have about, I would say, 20 different options of things we can do. And so the one that I think is most important now is just to highlight, can you share what Advent is doing specifically? It's just one of the levers. We got a ton, but this one I think is pretty unique, and most people aren't even aware it's available in Tampa. So Steve, jump into that.
Sure,
if you don't
sure.
mind.
Sorry to hit that button, give away your little.
No, you go ahead. That's fine.
So, yeah, so we have partnered with Advent Health and partnering with Dennis. So Advent Health, you know, is in your area. It's a great health system, great quality service. And they have over 1,400 locations throughout the Tampa area. So they also have another Advent Health East that is in the Orlando area. This one is focused on the Advent Health West around the Tampa, greater Tampa area. And what we've done, I think I mentioned earlier, these big Fortune 500 companies can walk into an Advent Health, a Cleveland Clinic, a Mayo Clinic, and saying, hey, we got 20,000, 50,000 employees. We want better pricing than you can give anybody else. If you give us that, we're going to send you our employees. What we've done is we're working, and this is probably our 5th or 6th, we call it direct to employer programs. And what Advent Health does is we bypass the intermediaries, which are Blue Cross Blue Shield, United, Anthem, Aetna, Humana, you know, the BUCAs as we talked about. They're bypassed, and Advent is the network. So what Advent does is they're partnering with you, the employer, and saying, we're going to give you a lower cost on your claims than you can get with the carriers today if you send us our people. So you're not only going to get quality service, but you're going to get the lowest cost in claims than you would with any of the carriers. And it's a great program, especially if you have 50% or more of your employers in the area. You're really going to recoup the savings. Your people will enjoy the quality of service. And like I said, this is probably the 5th one we've done in the country. And Dennis is part of it, and he's able to offer this to his employers. We already have suggested design plans that are going to help guide the employees and incentivize them to use the Advent Healthcare Network. And this, again, is a self-funding solution that can be incorporated into our medical captive.
All right,
So yeah, go ahead.
No, yeah, go ahead. You got a case study. Show that.
Sure. I just wanted to show you just 2 case studies. So these were two employers that we quoted using the Advent Health Network. This is a little bigger employer, a manufacturer, 335 employees. I just wanted to show you the type of savings that we're seeing on our proposals, their quotes. So based on the renewal rates that these employers were seeing, this particular manufacturer, at the annual expected, where most, if not all, our employers run at, we were going to save them the first year a little over almost $442,000 the first year. Even if they hit max cost, which once you get a quote, you know, Dennis gets a quote for you, I can go over that. But less than 1% of our employers have ever hit their annual max cost. You know, they were still going to save close to $11,000. And then this is a law firm. 300 employees, 60% of them in the Advent Health area, so a large portion of them there. They were going to save, if they run like a typical group, almost $600 first year, right? And if they, you know, hit the max cost, which less than 1% of our employees ever hit, about $137,500 would have been the first year savings. That's just the first year.
So I think it's important. This is the question that always comes up. So first and foremost, those case studies that Steve's showing you, companies that size, we would save them significant amounts of money. We're talking about plugging in one lever and moving it just a little bit different from what they're used to doing. So there's a process, right? So you pull one lever, you get people comfortable with that, you plug in another lever. What I find the biggest question is, well, I don't want to tell my people where to go or what to do. The fact is your employees now, they're kind of faced with something like this. They have 2 choices, door A and door B. And one's no more significant than the other. You might say, well, I don't want to go through door A because that's red and I don't like red. Yellow is a friendlier color. But that's literally the amount of transparency that we get with our health plans. What we suggest and what we always do is we always give the employees choices. Door A is you do whatever you want to do as an employee. So let me reiterate that. No change, you do what you want. No problems, your choice, right? Door B is where we know we're going to send you to facilities that are higher quality. So luckily, Advent has purchased some of the highest quality facilities in the Tampa Bay area. We have great healthcare in the Bay Area. There are lots of choices. Advent just happens to be one of the great ones. So if we can build it into your network and tell the employees, if you go to Advent, we're either going to waive deductibles, we're going to incentivize you in some way, but you can go wherever you want to go. But if you go to Advent, we know you're getting higher quality, so you're going to return to work quicker. You're less likely to have surgery over again. And we know that it's a high quality facility, and ultimately it saves everyone money. So I can show you all kinds of statistics that explain exactly why we know that these are great locations, but that's just one lever. But all we'll ever do is try and improve the plan for the employees and make them feel good about working for you as an employer and give them choices. And if they want to go to their doctor or they want to go to their facility, they will always have that option. We never take that away. As an employer, you don't want to do that. But what you do want to do is help educate them and show them where they can go. As an organization, I look at all of these 8 metrics. There are 8 key performance zones that I think every company has to deal with. I primarily am brought in first and foremost because my costs are too high. Dennis, fix my costs. Well, if you ignore all these other components and employees don't understand the value or how to use it, or you ignore some compliance component, you're going to lose whatever you put basically in savings. And at the end of the day, it's not going to benefit you. I look at these strategies with your company to determine strategic wise, will they work? Operationally, does it fit your organization? And tactically, can we even pull it off, right? So if we're stuck with COVID and we're all stuck at home, there are things that may not work. So we look at those things for your organization on a constant basis. The first decision I think you have to make is, 1, are we going to keep going down the same path? And 2, is my advisor actually even looking at this stuff for us? My latest client yesterday said, Dennis, I just realized that my advisor hasn't talked to me about reducing costs literally since we've had him as an advisor in the last 10 years. You're the only guy that's coming to me saying we might be able to save you some money. He still gets to decide whether he wants to take any of the advice, but he at least has someone looking at all the options for him. So he hired me as his consultant. I take over his current plan the exact way that it is now, and we work to show options. That's really your simple step. That's really the takeaway and the easiest thing that you can do to get started. So if you look at the next slide, I think these are the things that you gain when you look at these types of plans. Are they a good fit for you? I find for most employers, they are better than where they're currently at. Not always, but most of the time. But you get detailed reporting, total control over your plan and some of your costs. So imagine saving that money and either putting it back in the plan, putting it back in the company, or improving the plan design. Or better yet, let's consider the fact that COVID-19 is not a one and done situation. What if there were some other crisis that were to come up? My recommendation for every employer is get control of your plan. So in a worst case scenario, you just bolster and make it better. In a scenario where a crisis hits again, you have control over what happens, and you can focus more on how you're going to operate as an organization and less on how you have to cut costs and cut employees. Put yourself in a situation where you can work through it, and then understand you don't have to design it. You don't have to control every piece of it. We will navigate that for you. You get an expert level with me and my team to make sure that you get turnkey platforms. Normally, 99% of the time, we start with just duplicating exactly what you already have. You just get the transparency and control. We take exactly your same design, we duplicate it on a chassis that we can show you what's happening, and you gain that control. And if Advent Health is a good fit for you, then great. That's one of the levers we can plug in. We can incentivize employees to go get treatments at certain facilities. We can pay them a little bit of money to go see the best doctors in the market. We can just give them somebody to hold their hand through the healthcare process. So if they do get sick or they do get freaked out because something's going on with them, you know they're getting the best care and they're going to be able to come back to work the quickest. And they know that their employer is plugging in tools that are in their best interest as an employee. So it really is one of the best stories that we found. We just realized that a lot of employers don't know it exists. So Steve, go to the next one. I know we're running out of time. So if you wanted to get started, it's easier than you think. What we recommend is just a simple 12-question survey. We can put the link into the, I'm trying to think, the link is here. Can we put that into the chat box?
We can do it in a follow-up.
Okay.
email to everyone. We have the
Right, so
attendees,
yeah,
so we
let's
can
do that.
follow up with them.
We'll send you the link. It's a simple 12 questions. It comes to me. We do a simple analysis and we look to see, is there anything that we think we can significantly do to help you? If you just want to talk through one component of it and say, hey, I'm interested in that. I don't know that we're ready to make any big changes, but I just want to understand more. I would advise you that now is the time to do that. Don't wait till your renewal is 60 days out and you figure out that you're in a bad spot. Most carriers are bringing 10% plus increases. And so if you can stand another 10% increase and you're thrilled with your plan, you maybe don't have anything to do. But if you're tired of that, ups every single year with no transparency, you don't have to stay in that arena. And I can tell you the clients that we're bringing on board are thrilled, their employees are happy, and it's working. And it's really exciting and rewarding to be able to help people. So we're thrilled to bring that. Steve, I really appreciate you and what Roundstone's done to help us with that and through that process and Advent as well. So there's lots of tools, lots of solutions. Here's how you can contact us directly. We will record the video and get that posted out as a blog post on our website as well for follow-up, because today might not be the day, but we're here. We're excited about what we're doing in the Tampa market, and we just wanted to share that with as many people as possible. So thank you for that. Steve, is there anything that we missed?
No, if anybody has any questions, if you could just type those out, that'd be great, and we'll answer those. A minute. The chat box, sometimes it's difficult to find that on your.
I know there's a few people on here that already know this stuff, so they're preaching to the choir. I think they jumped on just to see if Dennis said anything stupid. That's what I get sometimes. Gina, you were asking the size. I have floated this down to, I've actually made Steve quote one down to 17 lives. So you don't have to be a big employer. There are some ramifications that might determine whether that's a better fit for you or not. There are a lot of tools that we have access to, but Roundstone is one of my best. If you're under 50 and under 100, they have worked extremely well. Like even scenarios where I went to Steve thinking this is not going to work, every one of them have come off with significant savings. And so we know it's a good solution, but it is a process. So I would tell you that I've done it down to 17. We typically like 25 employees on the plan or more is usually where I think things start to get better. And as you grow, there's more and more opportunity and levers and there's more room to do things, I think.
And I think,
go ahead.
Go ahead, you answer that question. Our employees are in different states working at client locations.
Yeah.
How do we work in such locations? So our captives ourselves, we're not limited to within a state. So we have employers that have employees throughout the United States. We have business throughout the United States, including Alaska. So Roundstone is not limited by your state. And for Dennis as well, he's not limited by the state of Florida where his employers he works with are.
So to talk about Advent is a massive network. The really big savings they're giving us right here in Tampa won't work if you're in, Tuscaloosa, right? But there are options for employees to get treated there as well, right? They're not penalized. They just really get benefit if they go locally. So if they're out of state, we definitely have options for them. In fact, frequently, what we'll do in a lot of cases with Steve specifically is we'll rent a network like Cigna. They have people all over the place and we just tap into that network. So there are a lot of options. It's just some options are better and more efficient than others. Some of them are easier than others. So for you, we might plug in some things that are a little bit more traditional to kind of get people comfortable with it. Once they understand it, makes it easy. All right, there's the link. So Kim put in thank you, Kim. She put the link in for the questionnaire into the chat box. So that makes it available for everybody to click. But yeah, it's a simple 10 or 12 questions. It'll take you 3 minutes.
Dennis, one of the questions I do get is, can you work with all the networks? And pretty much if the third-party administrator, that's a TPA, they're going to be doing a lot of the work. If there's any HR people on today, this TPA is going to take over a lot of your function and be working to help you. Employees will reach out to them for questions about coverage. If you're still comfortable doing that, that's fine. But that TPA, what we talk about today, a lot of this is behind the scenes. All your employees want to know is, what is my card? When am I going to get my card? And can I see the same physicians? And based on today and the networks with all of them, United, Cigna, and pretty much any doctor they're seeing today is probably accepting that that insurance, and they'll be able to go to the same doctor.
Yeah, it's astounding that all of these options exist. Employees love having the flexibility once they understand how it works. Remember, I'm looking at it as a 5-year strategy, not year to year. So the first strategy is let's just get control and start looking at what's going on, and let's start educating employees on some of the pieces that they can have an impact on. And then we start to phase these things in. If you said, hey, I wanted to do this for January 1st, today's the perfect time to get started. But step 1, 2, 3, 4, and probably 7 is to figure out whether it's a good fit, when it's a good fit, exactly how might it work, and how do we bring the employees along as vested stakeholders in your plan design. Because I can tell you one secret right now. Your employees, when they talk to me and I ask them, how do you feel about your health insurance plan? They don't blame everybody in the industry that's actually raising costs. They don't blame the market. They don't blame the broker. They might blame the government. That's usually pretty consistent. But they don't blame the people who are controlling and the PBMs and all those people that are actually raising your costs. What they do is they look and say, well, my employer's a cheapskate. He's not bringing me the best plan, which isn't helping you build culture. It isn't helping you attract and retain the best talent. And it's quite frankly not your fault. So bring in an expert like me so I can help communicate and take some of that pressure off of you and let me explain to them what's going on and tell them that you as an employer are being proactive to try and do everything that you can to contain those costs just in case, right? We don't want to ever cut benefits. We don't want to ever cut employees. I've had many employers say, you know what, we're not going to be able to give out bonuses this year. And I'm like, well, bring them some good news and say, we're looking at plan design and we're looking at, we might be able to improve it, right? My latest client improved the plan dramatically, saved the employees a lot of money, and they ultimately are in a much better place, especially from a physical and really mental health standpoint. So there's a lot we're doing in that arena just because of the stress and anxiety that everybody's dealing with. So if I'm an employer, it's a stressful time. We can help you with that. Steve, thank you for your time.